Hello, I'm Hartford Healthcare's Tina Verona. Thank you so much for joining us for this live Facebook discussion. I am here with Dr. Brian Wong. He is a neurologist, specializing in neuro-immunology at the Ayer Neuroscience Institute, part of Hartford Healthcare. Thank you so much for being here.
Thanks for having me.
It. Yeah. So first off, we're going to be talking all about multiple sclerosis. You specialize in neuroimmunology. How does that correlate with MS? What is neuroimmunology?
So neuroimmunology is a subspecialty within neurology which focuses on the immune system's role in contributing to neurologic diseases, and that encompasses diseases like multiple sclerosis, but other diseases as well.
What other diseases are we talking about aside from MS?
So some similar diseases that involve the immune system and the neurologic system include things like neuromyelitis optica or neurosarcoidosis.
And what exactly are those? Are they a form of MS or totally different?
Those
it's just part of the immune system?
Those are completely separate conditions. For instance, neuromyelitis optica looks very similar to multiple sclerosis in that it can cause episodes of optic neuritis where a patient's eyes become painful and blurry, or episodes of transverse myelitis where there's inflammation of the spinal cord and that can cause weakness or paralysis.
And when we talk about MS, it can be one of those tricky diseases to diagnose. It can be very difficult. A lot of times you hear that it's very similar to Lyme disease and vice versa. One could mean the other. How difficult is it to diagnose MS?
That's a really good question. It is difficult to diagnose multiple sclerosis because it can present in a lot of different ways. Some people have numbness in one part of their body or weakness in one part of their body or blurriness in their vision. Lyme disease can similarly cause a lot of unusual symptoms, including things like numbness and weakness, and oftentimes it's difficult to differentiate the two. They both are diagnosed with testing. Multiple sclerosis often will use things like MRI imaging, and MRI imaging will show abnormal spots on the MRI in conditions like multiple sclerosis, but they can also be present in conditions like Lyme disease. So differentiating the two is sometimes difficult and sometimes takes a neurologist to correctly diagnose the condition.
Yeah, and how would you go about by diagnosing the condition, whether it's Lyme disease or MS? What do you do? What can patients expect?
So the condition is diagnosed using both clinical symptoms that patients may experience, things like numbness or weakness that I talked about, but also using MRI imaging findings. So people with multiple sclerosis may have changes on their MRI which line up in a certain pattern in patients with multiple sclerosis, and sometimes when we administer contrast with those MRIs, there are spots that light up indicating that there's inflammation going on in the brain or the spinal cord.
Yeah. We're talking with Dr. Brian Wong. He is a neurologist specializing in neuroimmunology at the Ayer Neuroscience Institute. I want to talk about this new program. This is certainly exciting, and I know you're excited to be a part of this program and to launch it here in Southington. Talk to us about this program specifically for patients with multiple sclerosis.
That's correct. So it's patients with neuroimmunology conditions, including multiple sclerosis, and we're excited about the program because we feel that we can offer patients a variety of things to help them in their lives. The first being medications to prevent episodes of worsening and prevent disability, so patients can maintain their mobility, maintain their independence, and do the things that they enjoy doing in life, but also provide them with ability and access to gain referrals to other specialties, things like physical therapy or urology that may also be affecting patients with the condition.
Yeah, we do have a question from Darcy, and she says, or she asks, any new treatments for trigeminal neuralgia? Neuralgia?
So thank you, Darcy. That's a very good question. Trigeminal neuralgia is a very difficult condition to treat. You may have heard of medications that we use that are used in epilepsy, things like carbamazepine that are used for trigeminal neuralgia. That's often the first medication we go to use for patients with that condition. But sometimes if that doesn't work, we have other conditions, other medications, excuse me, that we can use. Alternatively, in very uncommon cases, there are certain surgeries that are used for patients that have very debilitating symptoms.
Now, as a neurologist specializing in neuroimmunology, that's an interesting sort of specialty or subspecialty of it, because MS, and we were talking earlier with the immune system, is interesting because there are some correlations there, especially with, we were talking about people with maybe an overactive thyroid that could be more susceptible to being diagnosed with MS. Talk to us a little bit about the correlation there.
Yeah, so we know that patients who have autoimmune conditions are more prone to develop other autoimmune conditions, and multiple sclerosis is an autoimmune condition, so people who have things like hypothyroidism caused by autoimmune problems can also develop multiple sclerosis.
What is the connection there between the immune system and multiple sclerosis or other conditions like MS?
Often the immune system has to balance being effective in targeting things like bacteria and viruses that may harm us, but also not be overactive and cause harm to our body. In autoimmune conditions, unfortunately, what happens is the immune system is overactive and it attacks our own body incorrectly, thinking that it's a pathogen, things like bacteria or virus.
Yeah, I think people tend to almost underestimate autoimmune conditions too. That they're not really a big deal, but they can be. They can be serious,
Certainly.
And they can lead to other conditions.
Yes, yeah. So things like multiple sclerosis are very serious conditions, and they can cause significant disability for patients. And that's why we're hoping that we can offer treatments for people that can minimize the effect that things like multiple sclerosis has on their lives. We're trying to prevent disability, we're trying to prevent episodes of worsening like relapses, and hopefully that will improve their quality of life.
We have another question from Betty. She asks, is this program mostly for newly diagnosed patients? Thanks for that question, Betty.
Thanks, Betty. That's a really good question. It's not for just newly diagnosed patients. For people who have carried a diagnosis of multiple sclerosis for a long time, we're happy to see you in the clinic. And hopefully we can provide benefit for people who have conditions that may need additional help, things like physical therapy or help getting to a urologist or maybe talking about different treatments that are available.
How far have we come in the progression of multiple sclerosis in terms of treating it? There is a lot of medications out there that can really slow the progression of this disease, but we certainly have come a long way, haven't we, in say maybe the last 10 years in terms of treating MS?
That's true. We've come a really far way. The first medications that were used specifically for multiple sclerosis were introduced in the 90s, but since then we now have 15 different medications.
Wow. And
some of the newer medications are extremely effective. If we can use those medications in the right patient, we are able to achieve some really amazing outcomes that we weren't able to achieve for patients that maybe were diagnosed, say, 50 years ago.
Yeah, definitely, certainly offering patients new hope. We have a question from Rob. He asks, do any of these approaches address progressive MS?
That's also a really good question, Rob. In fact, there is a new medication on the market just recently as of 2017, which is called Ocrevus. It's a medication that is used for relapsing multiple sclerosis, but is also used for patients with primary progressive multiple sclerosis. And it's the first medication that we have available for that condition, so it's really exciting that we can target that particular type of MS now.
Yeah, that's great. Yeah, because it's not just for newly diagnosed, but more advanced stages of multiple sclerosis.
Yeah, and so there are just really different types of multiple sclerosis, and
Yeah.
not everyone has those acute episodes of worsening or relapses, and some people have just a slow progression of symptoms over time from the very beginning, and those patients are unfortunately a little bit more difficult to treat, but now we have medications that we can use.
If there is a family history of MS, are you more likely to develop MS? Is there a hereditary factor there?
So multiple sclerosis isn't a genetic disease like we think of other diseases,
Right.
but if you do have a family member who has the diagnosis, that may increase a person's risk of developing MS just a slight amount. So for the average person, multiple sclerosis occurs in maybe about 0.1% of the population, but for patients with a first-degree relative of MS, that risk may increase to about 3%.
And what should those people be looking out for? What should they do? Should they do anything differently? What should they be doing?
We don't really recommend anything very specific for patients, for people who have family members with the disease. The odds are that if you do have a family member with multiple sclerosis, you will be unlikely to develop the condition. So you don't have to take any specific precautions.
Yeah. We have a question from Betty. She says, I have MS, just diagnosed with Sjogren's and erythromyalgia. Would treatment possibly help with that?
So, so Betty, those are several different conditions. Obviously, we have treatments for each individual condition separately. Sjogren's and multiple sclerosis, for instance, are autoimmune conditions which can have neurologic symptoms related to them. And so what we often do is treat each individual condition separately, but in the case that in some conditions we can treat both together with certain medications if the symptoms overlap.
We talked about variables of multiple sclerosis and that there are many. It's just kind of not a one-size-fits-all multiple sclerosis. There are variations of the disease that people have, and that's why I think treatment, individualized treatment, is so important. And that's one thing about this program that I think is so unique and special to patients, is that individualized, really targeted treatment approach, would you say?
Yeah, that's something we're really trying to work with in our program. What one medication that may work for one person may not work for another person. And so choosing the appropriate medication for the right person is the most important and sometimes the trickiest part of the job.
Right, and I think that is. I think it's finding that perfect blend, if you will, for a patient. You could try them on something and it may not be as effective, and then it's like, sort of back to the drawing board, right? Would you say it's kind of a tricky path to navigate?
Yes, oftentimes we find that patients, didn't respond to a medication as we had hoped, and then sometimes we have to choose another medication, sometimes a stronger medication or a different medication to help treat their symptoms a little bit better.
I want to talk about a fascinating study, a Finnish study that just yielded some interesting results in terms of vitamin D deficiency. People who have a lack of vitamin D deficiency, who live in parts of the country parts of the world that don't see a lot of sun, and the correlation between that lack of vitamin D deficiency leading to MS, or making you more prone to developing MS. That's fascinating to me. What is the correlation between the lack of vitamin D and MS?
So we know that there is an association with vitamin D and multiple sclerosis. For patients or for people who live farther from the equator and have less sun exposure, they have less vitamin D produced by their skin. And as a result, the lower vitamin D levels are associated with a risk of developing multiple sclerosis. Patients or people who move from a place where there's a lot of sun exposure to an area where there's lower sun exposure early on in their life, often before the age of 13, actually have the increased risk of that lower sun exposure location after they moved.
What is the adequate amount of vitamin D that you should be getting? And you always hear that more women are vitamin D deficient than men are. Is that the case? And what is the adequate amount of vitamin D that you should be getting?
When we test people's bloods, the appropriate level of vitamin D is often a little bit debated, but most of the vitamin D we get in our system is actually the result of sun exposure rather than through our diet. And so making sure that you're active outdoors, exercising every now and then, and just getting some sun exposure, especially in these winter months, may reduce the risk that you become vitamin D deficient. But if you do take a supplement, often for patients with multiple sclerosis, people may be on over-the-counter doses of between 2,000 or 4,000 units of vitamin D a day, and that sometimes helps keep their level above a low level on our lab.
Yeah. Betty has a follow-up question. She says her sister and a first cousin have MS. Should her daughters be getting checked or do anything to possibly avoid a diagnosis?
There, again, the risk of developing MS for people who have family members with MS is quite low, and there's nothing specifically we can do to prevent it. I would say knowing the association with vitamin D and MS, it wouldn't be unreasonable to take a vitamin D supplement, but there are no other specific precautions that we'd recommend.
Are we seeing younger people being diagnosed with MS? What are sort of the trends that we're seeing in terms of men versus women, younger people? What are the trends that we're seeing now in terms of people being diagnosed with MS?
For autoimmune conditions, which multiple sclerosis is one, it's often more common in females than males, and often presents itself at a younger age. So the most common person with multiple sclerosis is a younger person, perhaps in their 20s and 30s, and is also more likely to be female than male.
Interesting. I also want to point out back to the program that it's treating folks with MS, whether you're newly diagnosed or whether you're advanced progression MS, but also the follow-up care too, the rehab and that part of it. Let's talk about that sort of overall overarching part of the program that you are involved in.
Yeah, so care for patients with multiple sclerosis is not just putting them on immune therapies to suppress the activity of the immune system. We also try to look at the other symptoms that people may experience and address those issues. If people are having trouble walking, we may refer them to physical therapy. If they're having trouble using their arms for tasks around the home, we might refer to occupational therapy. For people who have urinary symptoms, we may refer them to urologist or treat them with medications to prevent some of their symptoms. And also, you know, ophthalmologists for vision and other specialists to make sure that we're putting patients to the right specialist to treat their symptoms, not just their neurologic symptoms.
You also hear a lot about Botox being used to treat patients with MS in terms of some of their symptoms. You hear a lot about Botox with folks with MS nowadays.
Yeah, so Botox is used in a lot of different ways, but for patients with multiple sclerosis, some patients experience tightness in their muscle, often called spasticity. And when that occurs, sometimes we can use Botox to loosen the muscle, and when that muscle relaxes, it allows patients to feel less tightness in that limb, and also they may experience less pain as a result.
Yeah. Interesting how far we've come with that, because you would never think that, but it does help a lot of people with spasticity and other symptoms that are causing them pain. We have a question from Jean. She asks, are there any new treatments that will reverse the effects of MS? Interesting.
That's a really good question, Jean. Unfortunately, we don't have medications that prevent the disability that has already occurred for people with multiple sclerosis. And so often, in that case, we try to prevent additional disability. So medications that we use for MS may prevent additional episodes of relapse, but if a patient already has difficulty walking as a result of MS, we unfortunately can't reverse it. But making sure that we're bringing patients to the appropriate people, like physical therapists, to help them maximize their mobility is important.
And of course, the medications do help slow the progression, or can in many cases
That's
slow
true.
the progression. Yeah. So I think that's important to add as well. We're getting so many great questions tonight from the audience. So thank you for asking these great questions. What's sort of the one takeaway message that you would like really folks to know about MS and about this new program that you're launching?
I think what I would like to say to everyone that is, I am very excited about this program. I think we're able to offer treatments and support for patients that we weren't able to before at Hartford Healthcare, and I'm really excited to be a part of it.
Yeah, I think it's such an important, valuable program that people can go to a place and sort of have all of that care right there specifically for you, and the appropriate follow-up care too. Where do you see treatment going in the future? What lies ahead for the treatment of MS? Where
once we were just trying to prevent relapses with the medications that we're using, we're really trying to target more aggressive outcomes nowadays. We're trying to really prevent people from having relapses, but also preventing them from having just activity on their MRIs, and preventing them from having subtle changes in their disability level that maybe we aren't able to pick up on just imaging as well. And so preventing all of those things, not just relapses, is really the goal of new treatments. And hopefully the therapies that we have now, as well as some of the newer therapies that are in development, will help us reach that goal.
Yeah, and I think with all of the medications versus, and we talked, maybe even 10 years ago, how far that we've come with these new medications is really offering patients hope, and really able to live with this disease and have a normal life with MS. Do you find that with your patients that you can?
Absolutely.
It's achievable.
Yeah, that's really our goal. What we want to tell our patients that are newly diagnosed with multiple sclerosis is that we're hoping that this will have a minimal effect on their life long term. We really want them to live their lives just as they would normally, and hopefully the only changes to their lives for the most part are new medications, and new doctor's visits.
Right, and that's so important. It's critical is to have your visits with someone like yourself, a neurologist, because you could possibly have to change the treatment course along the way.
Yes,
It's something that you always have to constantly monitor.
that's absolutely right.
Betty has a follow-up question. Is there anything that can be done to relieve tightness in the torso?
So, so Betty, you know, tightness is a problem for a lot of patients with multiple sclerosis. It's that kind of tightness in the muscle, that spasticity that I was talking about. For MS, we use a lot of different medications for that tightness. Things like you may have heard of, like baclofen or tizanidine. Those are common medications that we use. For patients that have very severe tightness, and very rare cases, we do use even, we have surgeries where pumps are installed to administer those medications on a continual basis.
We have a question from Darcy. She asks, is ketamine being used?
Ketamine is not something that's being used very regularly for multiple sclerosis. Really the mainstay of therapies are things like those 15 approved medications for MS.
Yeah, so a lot of new hope on the horizon, especially with this new program, and you are just here since September, so this is brand new. You are all hearing about it, so it's a special and exciting time for you, and we welcome you here. So Dr. Brian Wong, thank you so much.
Thank you for having
being
me.
here, and we of course thank you for all of your really great questions tonight. We really appreciate that. If you'd like more information about MS and this new program at the Ayer Neuroscience Institute here at Hartford Healthcare, call 1-855-HHC here. I'm Hartford Healthcare's Tina Verona. Thank you so much for joining us. We'll see you next time.